Think of an artificial hip as a precision-engineered component. Mechanically, it is ready to move, but it cannot function on its own. It requires a specific set of instructions to work with your body, instructions provided by structured physiotherapy. If those instructions are missing, the recovery stalls. Without a plan to retrain the surrounding muscles, patients often face permanent stiffness and a significant loss of strength that prevents them from returning to their normal activities. This is the 2026 report from The Best of Health, designed to help over 50s navigate the specific physiotherapy requirements of both the NHS and private healthcare systems. Rehabilitation begins almost immediately. Within hours of waking up from surgery, hospital staff will assist you in standing. This early movement is a vital clinical protocol used to reduce the risk of blood clots and chest infections during the first day of recovery. Most patients stay in the hospital for 1 or 2 nights. During this time, you will learn to use a walking frame, practice basic ward exercises, and receive a printed home exercise sheet before being discharged. While the hospital stay gets you on your feet, discharge marks a major shift in responsibility. The support you receive from this point forward depends entirely on the healthcare pathway you choose. Guidance after hospital discharge depends on your pathway. NHS care varies by trust. Some offer group classes, but many provide only an exercise sheet and helpline for self-managed recovery. Private packages guarantee appointments, typically 1 or 2 sessions within 6 weeks to monitor progress. For private sessions, location dictates price. A rural session costs roughly £35, while London clinics charge up to £100. An average course of 8 to 12 sessions over 3 months results in a total investment between £400 and £600. Your choice of provider determines whether your rehabilitation is a guided process with regular check-ins or a self-managed journey. Recovery follows a 12-week timeline where the physical demands increase as the bone and soft tissue heal. Early recovery focuses on circulation. Weeks 1 to 2 involve ankle pumps, glute squeezes, and short walks using a frame. Weeks 2 to 6 add standing hip abductions and mini squats with crutches. By week 12, step-ups and balance exercises lead to walking unaided. These physical gains lead to practical milestones. By the end of this 3-month window, most patients can return to driving and walk for 30 minutes without pain. This progression is what turns the surgical site back into a load-bearing part of your body. While the most intense work happens early on, the joint continues to improve for up to 2 years after the operation. Long-term maintenance focuses on low-impact activity. Regular swimming, cycling, or walking helps maintain the muscle strength required to protect the new joint without causing excessive wear. To follow this roadmap successfully, you need to ensure the professional you hire has the right qualifications for post-surgical care. Always check the HCPC register to ensure your therapist is licensed. You can also use the Chartered Society of Physiotherapy directory to find specialists who focus specifically on musculoskeletal recovery. To compare the physiotherapy offerings of 176 different private hospitals, you can access the full directory at thebestofhealth.co.uk. A hip replacement is a major operation, but the mobility you regain over the next decade depends on the structure of the rehabilitation you start today.